Ryan Reynolds here from Mint Mobile. I don't know if you knew this, but anyone can get the same premium wireless for $15 a month plan that I've been enjoying. It's not just for celebrities. So do like I did and have one of your assistants switch you to Mint Mobile today. I'm told it's super easy to do at mintmobile.com/switch.
Upfront payment of $45 for 3-month plan, equivalent to $15 per month required. Intro rate first 3 months only, then full price plan options available. Taxes and fees extra. See full terms at mintmobile.com.
Cancer survivorship is not as sexy as curing cancer. We need those cures to have long-term survivors, but we need to care as much about how somebody lives after cancer.
From Offscript Media, I am Matthew Zachary, and this is Out of Patience. Today on the show, I welcome Shelley Fuld-Nasso, Chief Executive Officer at the National Coalition for Cancer Survivorship. It's important to note that NCCS, as it's referred to because #acronyms, is the nation's oldest survivor-led advocacy organization founded during the Paleolithic era of cancer care, the time before time of 1986. Yes, the same year as Top Gun, Aliens, Crocodile Dundee, The Color Purple, and Rodney Dangerfield's Back to School also introduced the word survivorship into the lexicon because the disruptive forces behind NCCS's origin were just sick and tired of being called victims, a practice that somehow still continues today. NCCS is an advocacy group that I hold especially near and dear, as it was the first group that I was introduced to when I decided to quit my career and learn what it meant to become a cancer advocate. Their founder, the late, great Ellen Stovall, was one of my human mentor gateway drugs into the world of making cancer suck less. Shelley has a storied and robust history in advocacy based on personal experience and just an inner core of social entrepreneurship that gives her all the credibility that she doesn't even need to lead one of our time's dominant advocacy and policy organizations. Prepare ye to learn. This episode is dedicated to the memory of my friend, colleague, and mentor, Ellen Stovall. Enjoy the show. Shelley Fuld-Nasso, my goodness, how exciting it is to have you here on my show, Out of Patience. We've known each other a grillion years. Well, maybe 7 or 8 since you started at NCCS or even before then. But my listeners know that NCCS, the National Coalition for Cancer Survivorship, has had a very special place in my heart for many years because your originator, your founder, the late Ellen Stovall, was one of my earliest mentors, and I would love to have her be a channeling through thread of good karma throughout our conversation. But first, I will start off by asking you the question of the day. Full-time mom with kids running a nonprofit during a pandemic. Go.
Well, basically, you just feel like nothing's ever done well enough, but you just do your best, and that's all you can do. I mean, I have 3 boys. They're 16, 13, and 10 in 3 different schools and online learning, and trying to, everybody seems to be busier from a work perspective even though everybody's working from home during this pandemic, because the needs don't stop. Cancer patients' needs don't stop. And my husband works outside the house and he's in construction, and you can't really do that from home. So it's been interesting. But so we've survived our first week back to virtual school, and we're just trucking along, trying to do our very best. I think that's all anyone can do right now is do your best, because if you try to be perfect or even be amazing, you're not going to succeed because it's too hard right now.
Yeah, I've done a couple of shows around I don't like to overuse the word pivot, but how the nonprofit business model isn't really that flexible when the economy tanks. But Can you share with us any wisdom on anything unique or special that you guys kind of like had to figure out on the fly?
Yeah, I mean, we're a small organization. I mean, people don't realize that because we've been around a long time and we are a nationally based organization, but our staff is small, and that does give us a little bit of an ability to be nimble, and we work really well together, even though we don't get to see each other in person. And so we've continued doing what we our programs that we had planned for this year, but just converted them to virtual events for the events that we do, which we do policy roundtables, we do an advocate symposium. In June, we had to figure out how to continue to do a Hill Day where you have your advocates talking to members of Congress during, these crazy times and doing it virtually. It's been a big learning curve, but we've just adapted. And then we've also added some things that, weren't part of our repertoire, but we saw as important during a pandemic, which was, we added a podcast where we talk about COVID related issues called Cancer Convos. We are doing a project on telehealth because so much of cancer care shifted to telehealth of all of healthcare. And we knew that it was sort of being done on an emergency basis and rapidly implemented, but we wanted to make sure patients' voices were being heard and in terms of what's important to patients in telehealth and how it can be beneficial, but what are the ways that it's more challenging. So we continued everything we were doing and added more projects on top of it, all while working from home, many of us having kids. So it's been crazy, but we know that again, the cancer doesn't stop during a pandemic. In fact, the needs of cancer survivors are even more acute because they're isolated, they have fears of getting the disease, of access to healthcare. So we couldn't slow down.
First of all, I didn't think I understood that cancer doesn't slow down. I would think the pandemic would just end all cancers because the screenings stopped, right? So if there's no screenings, there's no cancer, correct? I'm sorry, I'm just using some logic from the government and all that stuff.
Right. Well, the big worry is, and I was talking yesterday with a group of radiation oncologists who are seeing people coming in with more advanced cancers because they're ignoring the symptoms. So, some of the smart people that I've talked with have said that, of course, we're going to have an issue with people not getting screened, but that the potentially bigger issue is the people who don't get symptoms addressed that may end up being a later diagnosis of cancer when it's less treatable. Of every 1,000 screening tests, you have a small number of cancers detected, but when somebody's already got symptoms and they're not going to see what's going on with them, and then the cancer continues to progress, we are seeing already and will continue to see later stage diagnoses. And I think that's what the medical experts I've been talking to are even more worried about, although of course the screening is still an issue.
So I want to do a Wayback Machine, if you would. So NCCS was founded in 1986. Right?
Yep.
So that was the year I think Back to the Future 2 came out, just for the Gen X references out there. Maybe I'm going to get corrected in the comments, I'm sure. But to that extent, it was very novel of an idea to even consider the word itself, survivorship, 35 years ago. I'm doing bad math in my head. What is the origin story? I mean, I know it, but for our listeners' sake,
yeah.
How did that come to bear? Was it resultant of the war on cancer years later? Who were the early advocates that said this is a thing that needs to happen?
So when the group of people got together in Albuquerque, New Mexico in 1986 to found the National Coalition for Cancer Survivorship, at that point, people were still called victims, cancer victims. And it was really, people didn't survive cancer before then. And as some new treatments were saving some people's lives, but not without a cost in terms of the long-term and late effects of their cancer. So people got together, including doctors, nurses, lawyers, average people who had survived cancer and didn't know where to turn for that help and support. And one of the leaders was Dr. Fitzhugh Mullen, who had written an article in the New England Journal of Medical called Seasons of Survival, where he talked about the seasons of cancer being kind of the acute treatment phase, but then also, the after effects. And no one was really talking about the living with the after effects of cancer at that point. And he had that gravitas of being a physician himself. He was young when he was diagnosed, and he published this pretty seminal piece. And he also wrote a book. And he was one of the people who got together. There were about 30 people who got together in Albuquerque that year and on a kind of weekend long meeting came up with the idea for NCCS. Another one was Susie Lay, who is a more than 40-year cancer survivor of multiple types of cancer and an oncology nurse. And she still works with us today, volunteers with us, and is an incredible leader. And unfortunately, a number of these longtime survivors have passed away in the last few years, even. Dr. Bolin died last fall. And some of our other founders have died in the past few years. And so that's been a huge loss for us. But, they paved the way for really understanding, first of all, the term cancer survivor. They define people as a survivor from diagnosis onward. So whether you have stage zero,
It was that far back with the day you're diagnosed, you're a survivor?
yeah, that was a really kind of core part of what they decided when they founded the organization, is that whether they have stage 0 or stage 4 and ultimately die of cancer, you're still a survivor. And in their eyes and in our eyes, we know that people don't always resonate with that term now. A lot of people tell us that, they don't like that word. They think of it in other contexts. They feel like if they have metastatic cancer and they're not ultimately going to survive cancer, they don't want to call themselves a survivor. We also hear from people who feel like, well, I'm still in treatment, I'm not a survivor yet. My view is everyone should use the word that resonates with them, that they feel like describes their experience. We don't tell people what word they should use, but when we say survivor and survivorship, we're talking about everyone touched by cancer. And when we're advocating for survivorship care, survivorship policy issues, we're advocating for everyone, not just, some people think of survivorship as this post-treatment period. But, now with new treatments, people are living so much longer with metastatic cancer. People who had previously cancers that were not a very good prognosis are now living much longer. And so people talk about survivorship as living well with cancer, whether you are in treatment or not, and that's, I think, a lot of what we focus on. And it doesn't matter what kind of cancer you have or what stage you are. You want to live well while you're going through this experience.
Yeah, I couldn't agree more. And, the choose your own metaphor. I just metaphor
Yeah.
to metaphor. Yes, exactly. Or first of all, fact check. I'm going to fact check myself. Back to the Future 2 was 1989. So I was off by 3 years. I apologize. My Gen X inner 9-year-old is horrified, and I retract. So with that said, my Wizard of Oz reveal of the policy world, of the cancer advocate world, came through a gentleman named Craig Lustig, who you and I know extraordinarily well. Craig is a dear friend. He sought me out. He found me. And Stacia Grosso, who worked there at the time, brought me in. I met Ellen. And they asked me, do you want to be an advocate? My words, what the hell is an advocate? I have no idea what that meant. Why is this called this word? And what my takeaway was, Ellen's on the record saying this a million times, Ellen Stovall, that quality of life is tantamount to quality of care. And that may be jargon to some people, but for me, that meant I had a chance to make what I went through suck less if there was another me diagnosed that day 10 years later. And I've been carrying that ever since. So let's talk about what has happened, because you're coming up on your 35th year. You've been there for 7 years. You've been working in the nonprofit space for a very long time. You're one of the few people doing what they studied, public health policy. Look at that. You're not like a painter, or you're doing the stuff. Where are you at in the life cycle of having entered this space and seeing that you're still here? This is an organization that has lasted for so long.
Yeah, we've lasted for a long time because the needs are so strong, and we've made a lot of progress. Ellen Stovall, who you mentioned, was also a dear friend and mentor to me. She died in January 2016 from cardiac complications from her treatments over 40 years before. She's still a guiding star for us. I think of her, what would Ellen do? What would Ellen think? And some things have evolved even since Ellen's time. Some of the things that, were kind of prevailing wisdom are not anymore. But I still think about her passion for helping people live well with cancer. That's what she talked about. Live well with cancer, whether that be while you're in treatment or when you are 40 years out of your cancer treatment, but you still have those long-term effects. So what I think some of the accomplishments are really helping people understand why this is important, and helping advance the science, the research around cancer survivorship. One of the accomplishments during Ellen's days was putting out paper on kind of imperatives for quality cancer care, I believe is what it was called. And she got that in the hands of the NCI director at the time, Rich Klausner, and he read it and said, we need to start this Office of Cancer Survivorship at NCI. And Ellen was really instrumental in making that happen. And then in recruiting Julia Rowland to the first director of it. And I'm thrilled to tell you, because we just announced it today, that Julia Rowland and Dr. Tom Smith from Johns Hopkins were just selected as the Ellen Stovall Award winners for 2020. So we will be presenting the award to both of them in November of this year, and we're really excited about that. And I know that Ellen would be really pleased with those two selections, because those were both people who were very dear to her, and she really believed we're working to try to help people with cancer and really try to not just help individuals, but help the system, move the system along. So Julia led that office at NCI and helped advance the research around survivorship. And we have made a lot of progress in terms of understanding what cancer survivors need and what some of the long-term effects are. I think we still struggle to get people to care about it and to understand it and to place enough emphasis and money and dollars behind it. And that's where I feel like there's still so much work to do. Cancer survivorship's not as sexy as curing cancer. And so obviously we need those cures to have long-term survivors, but we need to care as much about how somebody lives after cancer as the fact that we're allowing them to live after cancer. And I think that, I mean, you know this, Matthew, but I hear this all the time from cancer survivors who tell me the first year after treatment was harder than the treatment itself, because they're thrust in. Ellen would say, like, you're, dropped into a new land without a map and not speaking the language. That's what survivors face after they finish treatment. And there's a party and a bell and a cake. And then now they have to try to forge their new normal. Some people hate that expression. Some people like it. But it is a new way of living after cancer treatment.
Back with our guest after the break.
Craving your next action-packed adventure? Audible delivers thrills of every kind on your command, like Project Hail Mary by Andy Weir, where a lone astronaut must save humanity from extinction, narrated with stunning intensity by Ray Porter. From electrifying suspense and daring quest to spine-tingling horror and romance in far-off realms, unleash your adventurous side with gripping titles that'll keep you guessing. Discover exclusive Audible originals, hotly anticipated new releases, and must-listen bestsellers that hook you from the first minute. Because Audible knows there's no greater thrill than the one that speaks to you. Discover what lies beyond the edge of your seat. Start your free 30-day trial at audible.com/WonderyUS. That's audible.com/WonderyUS.
So I was reading in your bios and some of the pieces written about you. By the way, you're cancer famous, in case you didn't know that, about a gentleman named Dr. Brent Whitworth. And I feel it to be appropriate to recognize him and his story and how it impacted you and drove you to do what you're doing today.
Thank you. So Brent was my best friend in college. We met our very first day of college at Rice University in Houston, Texas, and we were political science majors. And then after college, he went and worked as a buyer in retail, and then decided that what he really wanted to do is be a doctor. So he went back to back to school to get his prereqs, because he was a political science major, and then medical school. So he became a doctor a little bit later in life than some, just because he'd taken this hiatus for a few years to work in the retail business. But he became an internal medicine doctor in Dallas, and he was so passionate about taking care of his patients. And he and I would talk about health policy a lot, because I was working in that field by then. And I just, I loved how much he cared about his patients, and he would spend the time with them to really help them diagnose their issues. And I sent patients to him. I couldn't go to him myself because we were too good of friends, and I just thought that would have been weird. But I knew people who went to him as a doctor and who had problems that they had not been able to get anybody to help them address, and he just took the time to help them figure it out and help them really address it. And then one day I remember I was in San Antonio for a convention, some kind of cancer-related convention, and he called me and he said that he had been diagnosed with stage 4 cancer. And it was kidney cancer, and he knew it was really bad. It was really bad, and they didn't think he would live even 6 months. And he was in a clinical trial for a drug that was later rejected by the FDA, but it did probably help him. We don't know for sure, but he lived 19 months after his diagnosis. So he lived longer than he initially thought, but definitely did not have a great quality of life for some of that. And the hardest part for him was he had to give up his profession, and really it was his identity as a doctor. I mean, he cared so much about taking care of people, and he couldn't do that anymore because he couldn't risk his own immune system, and he didn't have the stamina, and he tried to go back to taking care of patients, but he just couldn't do it. And so that was so hard for him. And I saw some of the pluses of the healthcare system, the fact that he got to be in a clinical trial. He did have a lot of good care along the way, but he also I just saw some of the areas in the healthcare system that really failed him, like the fact that we don't really talk about end of life like we should, and we don't get people the palliative care that they need to help address their symptoms. We don't get them into hospice early enough. At the time, I had read Atul Gawande's article in the New Yorker that later became his book, Being Mortal. But it started with an article that he wrote. And a good friend of ours had a sister-in-law who died of brain cancer, and she was very young. She was in her 20s, and they had used the article as a way for the family to talk about what's important at the end of life. And so I remember Brent calling me one day and telling me, Shelley, it's time. Can you bring copies of the article? So I brought copies of the article to the hospital. He was in the hospital at that time, and I gave them to his partner, Bill, and his parents so that they could read it, and so that he could use that as a way to talk about what he knew was coming, because he was a doctor, and he knew, he was a religious person. He prayed for better outcomes, but he also knew that, he had an incurable cancer and that it wasn't responding as well to treatment. And he had these discussions, these very difficult discussions with Bill and his parents. And then he said to his doctor, and he was in the hospital for, terrible ascites. His belly was swollen. He couldn't eat. He couldn't keep down food to have the scan, or he couldn't keep down the contrast liquids to have the scans that he needed to have. He was wasting away. You could look at him and see that he was dying. And he said to his oncologist, I think it's time for hospice, which, it's not usually the patient saying that, but he wasn't just a patient because he had this medical training. And his oncologist said to him, well, I've never had a patient throw in the towel after one line of therapy. And that just it just derailed everything he'd done in terms of having the difficult conversations with his family, because then they all started thinking maybe there are other treatment options. And then they got all spun up on the idea that maybe there was something that could help him. And they started researching all these potential treatment options. And then the next day he finally has the scan that was delayed because he couldn't keep the liquids down. And it shows that the cancer is just rampant in his body. And he went home that day with hospice care, and he died a week later. And I just think, he should have had more support at the end of his life. He should have been in hospice care more than a week. It shouldn't be that hard to get that kind of end of life care, but we still don't want to have the conversations that need to be had. And we don't want to, I guess, maybe admit when things aren't going the way that we hope they would go. But by doing that, people don't get that relief and support that hospice care can provide for as long as they should have it. Because, I think about my father-in-law. He had hospice care for 2 years, and it wasn't a mistake. When he first went into hospice, it was a reasonable conclusion that he had 6 months or less to live. But the hospice care made him comfortable and helped him live well. And he did well, and he lived. And for a good part of that, he had a decent quality of life. And so hospice can do so much for people, but we just don't want to have those conversations. So I'm sorry, I didn't know you were going to ask me about Brent, and I'm telling you probably more than you wanted to hear, but it just, seeing what he went through made me want to do better for patients so that they don't have to suffer and that they can get the help that they need.
I really appreciate your opening up, and I didn't intend for this to be anything other than the humanity it became. And one of the most important things to me is showing that people who do the jobs that we do are real people. And we've been through hell and back, and we've suffered, and we are the community we try to help every day. So I hope our listeners are really appreciating the fact that, we are born of our own conditions, and we choose the life to represent millions of people and make their lives better every day. And to that point, I do want to focus on the good news of what has actually happened, what has actually been progress. NCCS has been at the forefront of so much policy initiative change over the last 30, 35 years. It's almost hard to concretely point your finger at any one thing that hasn't been groundbreaking and institutional. But I think it's important, especially in the climate that this show is being taped in early September, it's going to air in early October, that the Affordable Care Act, otherwise known as Obamacare, which again, worst nickname ever because of what it became. And with all the faults, we love you still, you guys, NCCS, ran such a hell-bent campaign around the country, around the rights and the liberties and the freedoms of pre-existing condition and explaining that to people. I don't think it could ever get the attention and recognition it deserved to save millions of people the stress by getting that downvote moment with John McCain on the House floor. What were you thinking that day?
So I was one of the nerdy folks who were up at 2 or 3 in the morning watching as the Senate was voting on the repeal of the Affordable Care Act. And I was texting back and forth with my colleague Lindsay, and we didn't know what he would do. We were shocked. We were hopeful, but shocked that he said no. And I think he said no in large part because of the procedural issues of how it was handled, more so than. I think people think that he changed his mind because of his own cancer diagnosis, and I know that probably weighed into it. But I think he was just also he believed so much in the process of how the Senate should work, and it was not working the way it should work and the way it had worked over the many years he had been there, that he didn't want to be part of doing something that really was not the right way the Senate should work. And I'm sure that the actual substance of the issue weighed on him as well, because he had been diagnosed with cancer, and we had advocates in Arizona who were reaching out to him and talking to him. But we were surprised, really. Honestly, we thought at the beginning of 2017, when Trump had won and both the House and Senate were Republican, that it would be one of their first orders of business to repeal the Affordable Care Act. And we gave many presentations and did a lot of advocacy over the year about it. And we always used the slide of the dog that caught the car, because they had been talking about repealing it for so long, but really did not have a plan to replace it. I think that the advocacy on behalf of people with pre-existing conditions really helped people. It's interesting how the sort of approval ratings approval of the Affordable Care Act was not great before there was a threat of losing it. And then people realized what they would lose. And cancer survivors had such a story to tell, because it did impact their ability to, not having to be tied to a job because they would lose lose coverage because of their pre-existing conditions, was a huge benefit to cancer survivors, and knowing that they wouldn't be discriminated against in their rates. And I just remember thinking, as we saw the House moving in the spring of 2017, as we saw the House moving toward their repeal efforts, thinking, what can we do? We're small. We're not, some of these huge advocacy organizations, but what can we do? And I thought, I know that there's a lot of cancer organizations that really don't have they're focused on serving patients and raising money for research, and they don't have the time to follow the ins and outs of everything going on Capitol Hill. And so could we try to help be that back end for them of like following what was going on, letting them know what they need to do, giving them the tools to like tell their constituents to make the calls. And could we, reach out to everybody that we could think of and get them to sign on to something, a social media campaign that we could promote and have, we started with 20 organizations and then 40, we built up to having 40 or 50 cancer organizations signing on to these social media campaigns, telling people to call their members of Congress about how important the protections in the Affordable Care Act were. It was really just born out of what can we do? How can we help with this? We were pretty sure it was going to get repealed, but we still knew we had to do everything we could to fight against it. And so that day when Senator McCain cast that vote, I mean, it's just an iconic, image of him doing the thumbs down and kind of putting the nail in the coffin on that version. I mean, they certainly tried other avenues to repeal it, but here we sit today, and it still provides people protections, and it's not perfect. There's still, it still costs too much. There's still a lot more work to do, but at least people who have cancer, a cancer history, or any other pre-existing conditions know that they have some protections that they would not have without the Affordable Care Act.
For sure. The Senate downvote heard round the world. And I will tell you, just for our listeners, I know this is audio, but I remember working with you on that campaign, rallying, those 50 groups. And you had created maybe like an image, right? Of like, and then there were maybe there were 6 logos. And then there were 14 logos, and the logos kept getting smaller and smaller because it's like how many logos can you cram on a NASCAR? And by the end of it, it was like it was indecipherable, but that was the best part because it made like this mosaic of all the groups, and it just really speaks to how it's so easy to overblow what the word coalition means. Like coalitions don't work. You guys have proven for 35 years that when done right, by the people, with the people, and for the people, coalitions can actually work. In the time we have left, this is a loaded question and there is no short answer to it. But, we talked about repeal and replace, and it isn't perfect, and it's been, X amount of years. Is there any one or two quick tune-ups and oil changes you can do to ACA to get it on a different, better track for the next couple of years?
Wow. Okay. So I think that some of the things that have been done over the last few years that have weakened the insurance market that was required in order to keep premiums down. So we needed a marketplace where everybody was in because there was an individual mandate, and that we didn't have peel people off. So the problem is, insurance is a way to keep costs down for people who would have a lot of costs, but then people who are relatively healthy maybe don't have a lot of costs, maybe aren't getting their money's worth because they're paying for insurance that they don't really need. If you then offer them these products that are out of the marketplace that allow them to buy really skimpy insurance plans, then you kind of ratchet up the cost of the people left in the insurance market. And so then you have only the sick people, and then premiums rise for those people that have higher health needs. Unfortunately, the skimpy plans that are available sort of off the ACA marketplaces don't really provide a lot of protection. So if you buy them and then you end up getting sick or getting diagnosed with cancer, it doesn't really provide a lot of protection. It might give you a way to sort of check off if there was an individual mandate that, yes, I have a plan, but there's no individual mandate. So it's almost like it's not even worth buying them because it's not going to really protect you if you actually do get sick. I think if we were able to do some more premium supports to help people, because I think the biggest concern with the Affordable Care Act right now is that the premiums are still too high. So if we could support people better in their premiums so that they don't have these astronomical premiums, and if they need to buy insurance through the marketplaces as opposed to getting like employer-sponsored health insurance, then there's a number of different ways to do that. But I think that's kind of the biggest complaint is that it's still not affordable. And we never did reach all of the affordability hopes that were in the Affordable Care Act. We reached a lot of the access hopes, but not the affordability. So I think that's where there's room to improve over time. But I think that it may require undoing some of what's been done over the last couple of years to peel people out of the marketplace and then just make the marketplace more affordable for everyone.
I'm not going to start a podcast called ACA 2.0, but if I were, I would do it with you.
Thank you.
Shelley Fuld-Nasso is the Chief Executive Officer at the National Coalition for Cancer Survivorship, and we're dedicating this episode to the late Ellen Stovall. Thank you so much for coming on the show.
Thank you so much for having me, Matthew.
That's all for today, folks. If you like the show, be sure to subscribe, leave a review, follow us on social, and tell all your friends to listen. Out of Patience with Matthew Zachary is a product of Offscript Media. Our executive producer is Matthew Zachary. Our senior producers are Jen Horangeff and Andrew McDowell. Darren Tunn is our production intern. It is recorded, mixed, and edited by Matthew Zachary. Our theme music is by the Mike Van Allen Quintet and by Mara. For advertising and media inquiries, email media@offscript.com. Hit us up at contact@offscript.com to share comments, feedback, and make guest recommendations. For more information, visit offscript.com.